What is an oral health coach? I'm glad you asked. An oral health coach is like a personal trainer for your mouth. Depending on their approach, demeanor, personal experiences, and beliefs, oral health coaches are part mentor, part coach, part friend, and even part drill instructor at times. Our consistent goal is to oversee an individual's and family's oral care routine in a group or private setting to help you find treatment, prevent disease, and improve your overall oral health and body health. Our mouth is an early warning system into our body, one we take for granted and don't pay a whole lot of attention to until there's a problem. Dental disease is silent. Our teeth are the hardest, strongest part of our body, and the only part of our skeleton we clean. It takes a lot to break our teeth down, and there's no pain until the nerve is involved. Oral health coaches love to help people, and it shows. They focus on a healthy mouth, a healthy lifestyle, and they're committed to bringing awareness to the connection your mouth has to the rest of your body. Their desire to share their passion with others is apparent, which allows them to serve as role models for the challenges we face in bringing our mouth health and our overall health to the next level. A good oral health coach believes every client has the capacity and the potential to succeed. Like personal trainers, they help you get excited to train, energize, and tweak your routine to get results. You can be physically fit, but if your mouth is not healthy, you're not totally healthy. Do you even know the health of your mouth? That's for another episode. But it's also why you might need an oral health coach. An oral health coach can help you know what to look for, what questions to not only ask yourself, but also your dental professionals. 1 out of 2 people in the United States has gingivitis, and cavities is the #1 preventable childhood disease. 85% of the US population is affected by some form of dental disease. Whether or not you believe it, cavities are a disease. Unless you see a dentist and have x-rays taken annually, you might not even know you have a disease because they start small and it progresses slowly. Heart disease is the leading cause of death in the United States. The bacteria in your mouth are linked to the disease in your heart. If your mouth is not healthy, the bacteria in your mouth can contribute to not only heart disease, but also other diseases like low birth weight, preterm delivery, diabetes, erectile dysfunction, Alzheimer's. Diabetes affects millions of people, and the health of your mouth can exacerbate your diabetes. If your mouth's not healthy, your sugar might be more out of control. So what am I saying? I'm saying it all starts in your mouth and what you do at home. 64 million of our US population has either gingivitis, cavities, or gum disease, or a combination, which means either the tools, the products, or the technique you're using at home just is not cutting it or helping you solve the problem. Cavities and bleeding gums are not normal. If you see a dentist regularly and you're still having cavities and bleeding gums after treatment, there may be an underlying cause. The answer might not be you need to brush more or floss more or watch what you eat. There might be more to the story, and you need to be your own healthcare advocate and find the root cause. The pun was intended. My name is Sherry Wertz, and I've taken my 30 years in the dental field along with my personal experiences of watching the progression of disease in the mouth of not only my patients, but family members being diagnosed with things and passing away. So bringing awareness to this silent disease is important to me and how it affects your overall body. Look, we don't know what we don't know, but we need someone to tell us what we might not know so we can seek treatment and do better, save time and money. Research and data are showing the link and connection of the bacteria in your mouth to many other systemic diseases. Our healthcare system is built to treat disease, not to teach you how to prevent it. A system where we spend $3 trillion a year. The average person spends $5,000 to $10,000 a year on healthcare costs. With everything that's happened with COVID-19, awareness, prevention, and building a healthy immune system are now more important than ever before. And as humans, we tend to not take care of things until we're in pain or it's a problem. But prevention, when it comes to your mouth, is simple, and it starts at home with you. What I hear every day is, we don't have time in the morning, or we're too tired at night. But it's a couple of minutes a day, taking care of your mouth, brushing your teeth, even if you don't floss, that could help keep you away from the dentist, the doctor, the pain points, and the fear of going to the dentist, things that you can do at home. Let's think about this for a minute. What part of your body do you use most in a day? You guessed what I'm going to say, your mouth. We eat, we drink, we speak, and sometimes breathe with our mouth. We put things in our mouth all day long, sometimes with our hands. And we use our hands to touch our face 16 times an hour, our eyes, our nose, and our mouth. I hope you're washing your hands, because the bacteria in your hands then go in your mouth or your nose. And if you're only brushing once a day, that bacteria is in your mouth for 24 hours until you get in there and disrupt it. If you brush 2 minutes, 2 times a day over the course of your life, you only spend a total of 82 days of your entire life. Think of how much time we spend doing things other than brushing our teeth. Yet brushing our teeth could save us more time and money. I'm drawing attention and bringing awareness of just how important the health of your mouth is to your overall body and how much time we should be dedicating to the care of our mouth. Would spending 4 to 6 minutes a day on your mouth be worth it if you could prevent disease instead of paying for expensive treatments to treat disease that could lead to other diseases that need more treatment? With an oral health coach at home, you can learn the tools, techniques, and products that are right for you and your family to not only stop disease, but prevent disease. Most dental professionals don't want to hurt people's feelings. And most people want to be good at things. They don't want to suck at doing at something. Yet the majority of people suck at brushing their teeth and their kids' teeth. And it's not appropriate to tell your patients that they suck at caring for their teeth, but it is the cold hard fact. Teenagers are the worst at caring for their teeth. 95% of kids with braces have gingivitis and have no idea what it is, how to treat it, and how to prevent it. I have had a few people say when they see me in the dental office that they don't want to see me for their next cleaning because I hand them a toothbrush, a mirror, and show them how to hold the toothbrush, angle it, and where they're missing. So when they go home, they can get those spots. But I've had even more people tell me that no one has ever showed them that way, taken out a toothbrush, had them brush. They didn't know they were supposed to be holding a toothbrush that way or brushing their gums. My goal is not to shame anyone or make you feel bad. I just believe if you know better, you can do better. But how can you do better unless you know better? And you know how, and someone has told you how. I advocate starting with your toothbrush and getting good at using that tool before adding another, even floss. You may be doing a great job taking care of your teeth, brushing, flossing, watching what you eat, yet you're still getting cavities, gingivitis, and gum disease. Why? There's a reason. You need to find out why. Dental disease doesn't start overnight, and it won't go away overnight. But the one thing you can do is be aware, be consistent, and do better over time. I hear every day how dentistry is really expensive, but it doesn't have to be. Don't wait until there's pain in your mouth. An oral health coach can teach you what to look for, how to look for it, before it becomes a full-blown problem. Unless you bite down and crack a tooth, dental disease is a slow, progressive disease. Imagine if you could save your kids from cavities or a horrible dental experience like I had when I was younger, which set me down this road to helping other people. It doesn't need to happen. If you start young and create good oral health care routines with your kids, they can enjoy going to the dentist, look forward to going to the dentist, not be afraid of going to the dentist or dreading it. It's not too late to start maintaining your mouth. It's never too late. So you can keep your body healthy. If you only remember one thing watching this, I hope it's to remember that bleeding gums, cavities, and pain means something's not right with your mouth or your body. If you go to the dentist and you or a loved one always leave with cavities, it means something's off. Find out what. Are you mouth breathing? Are you grinding? Is your mouth more acidic? Are you not doing a good job taking care of them? Look into it. Be your own healthcare advocate. Hiring a personal trainer or oral health coach might seem like a luxury if you're on a tight budget. But if you really want to get the most out of your time and money and be healthy, hiring a coach is a great investment. The improvement in your oral health and fitness levels are an investment into you and your quality of life, and it can even decrease healthcare costs over time. Don't take my word for it. Here's a mom of 3 kiddos that I worked with who was glad that she made the investment and took control of her family's oral health. Watch this, and if you'd like more information, visit www.dentalhygiene411.com and join the Healthy Mouth Movement. Today we have Alyssa, Charlotte, and Susie, and we are going to do toothbrushing. So I'm going to have Alyssa tell me a little bit about the challenges she has with each of the three kids because they're different, correct?
Yes, they're all very different. My 2-year-old, I've been having issues with just making sure to get in there properly. She always wants to do it herself. And so whenever I try to brush her teeth, she grabs onto the toothbrush and jerks it around, and I don't want her to get hurt, so I end up just letting her do it by herself. But I know she's not getting it done properly. And Sherry was able to get in there with the knee-to-knee technique. And she was able to really brush her teeth right and do it with me as well. And so my 2-year-old actually sees it as a fun time now and lets me brush her teeth for her. She actually just last night ran to me with her toothbrush and was excited to brush her teeth and actually let me do it. So definitely a huge win there. With my 4-year-old Charlotte, totally different issue with her. She has sensory issues with her teeth. She's always sensitive, she's always crying. Whenever I try to brush her teeth, she doesn't let me brush her teeth either. I was worried with her about having gingivitis, and I had seen a couple cavities, but Sherry was actually able to get in there and really see what was going on. Charlotte laid back for her, and we actually got to see that she had several cavities and some issues on her top teeth and a growth in her gums that was causing a lot of the sensitivities that I didn't even know anything about. So now we know. So now I can get her to the dentist and get that taken care of. And then with my oldest, we tried brushing her teeth. We thought we were doing it the right way. We brushed her teeth twice a day. I made sure to keep as many sweets away as possible. And it seemed like I was doing everything right, and yet she was still getting cavities no matter what I tried. And so Sherry was able to show us just proper brushing techniques with her as well, and showing us like the different angles and things that she wasn't reaching that I thought I was doing right. And using the dissolving tablets as well with the stain also showed us that where we were missing when she was brushing, to give her a visual since she's older, and me as well, to really see what she is missing, because I let her brush her teeth by herself because she is, 6 years old. So it's just definitely so much information, valuable information. We'll have better, healthy teeth with less cavities. Thankful for Sherry and everything that she was able to show us.
Charlotte ended up having those 2 front teeth removed, and this was the car ride home from the dentist, and she was a trooper. Join the Healthy Mouth Movement and find out what you can do to engage your children, make toothbrushing fun, and know what to look for before it becomes a problem. If this was helpful, subscribe, like, and share. And go to dentalhygiene411.com for more information or to schedule a 15-minute free consultation.